Welcome! In this explainer, we're going to demonstrate the right way to administer ear medications. We'll walk you through the entire process for both eardrops and irrigations, giving you all the details you need to do this safely and, of course, effectively.
Have you ever needed to give ear medication and just wanted to be absolutely positive you were doing it correctly? Whether it's for someone at home or in a clinical setting, getting the technique right is just so important. Well, that's exactly what we're here to break down today.
Okay, let's dive right in. So here's our game plan. We're going to start with getting our equipment ready, then we'll cover all the patient safety and prep work. After that, we'll get into the hands-on stuff, demonstrating eardrops, and then ear irrigation. And we'll wrap it all up with the essential aftercare and documentation.
So let's kick things off with Section 1, getting your equipment ready. Like with any procedure, having everything you need right there before you even start, well, that's the first step to making sure everything goes smoothly.
First up, for eardrops, the equipment list is pretty simple. You'll need a pair of clean gloves, a cotton-tipped applicator just to clean the outer ear, the right medication with its dropper, and, if you have one, a flexible rubber tip adds a nice layer of safety.
Now, if you're doing an ear irrigation, you're going to need a few more things. We're talking a moisture-resistant towel, a basin to catch all the fluid, the irrigating solution itself, and this is important, it needs to be warmed, a container for it, and of course, a syringe.
All right, next up is Section 2, Patient Safety and Prep. And listen, these pre-procedure steps are completely non-negotiable. They are absolutely critical for keeping the patient safe and building that all-important trust.
You have to follow these 3 checks every single time. First, double-check that medication against the record and check that expiration date. Second, make sure you have the right patient. And third, clearly explain what you're about to do. Seriously, just letting someone know what to expect can make all the difference in the world.
And the final prep steps are just as vital. You'll start with really good hand hygiene. That's just basic infection control 101. Then make sure the patient has privacy. And finally, help them get into a comfortable position that gives you good, clear access to the ear you'll be working on.
Okay, time to get into our first demonstration. Section 3, Demonstrating Eardrops. We're going to focus on the precise technique you need to make sure that medicine gets exactly where it's supposed to go. So first things first, go ahead and put on your gloves. Gently clean that outer ear, the pinna, especially if you see any discharge. Next, drop the correct dose of medication. And here's a huge pro tip. If you accidentally drop too much, get rid of the excess. Don't put it back in the bottle because that can contaminate the whole supply. Now, pay close attention here because this next step is so important, and the technique actually changes depending on the person's age. To straighten out the auditory canal so the drops can get in there properly. For an adult, you'll gently pull the pinna up and back. But for a little one, a child under 3, you're going to pull it down and back. Getting this right is absolutely key.
And this right here, this is a golden rule you just can't break. Never ever let the dropper touch the ear. You want to hold the tip just above the ear canal. It seems simple, but it's crucial for preventing contamination of the medicine and protecting the patient from getting hurt.
Okay, once that canal is nice and straight, you're ready to go. Let the drops fall on the side of the canal, not directly down the middle. Then, have the patient stay in that position for just a few minutes. You can gently press on the tragus, that's the little flap of cartilage in the front, to help the medicine work its way down. And finally, if it's been ordered, you can loosely place a cotton ball in the ear.
Awesome. Okay, let's switch gears and move on to our second demonstration, Section 4, Demonstrating Ear Irrigation. This one takes a slightly different setup and, as you'll see, a really gentle touch.
And just like before, communication is everything. It is so important to let the patient know what to expect. Telling them beforehand that they might feel some fullness or warmth, maybe a little bit of mild discomfort, that can prevent any surprises or anxiety and just makes the whole thing go a lot smoother.
So, to get set up for the irrigation, first get the patient positioned with their head tilted towards the ear you're treating. Then you'll place that waterproof pad and basin to keep them nice and dry. Finally, fill your syringe with the solution. And remember, it has to be warm. Using a cold solution can actually make someone feel dizzy. All right, time for the irrigation itself. You're going to start by straightening the auditory canal using that same age-appropriate technique we just talked about. Then, and this is key, direct a slow, steady stream of the solution against the roof of the canal, not straight at the eardrum. You want it to flow out on its own. Just keep that gentle stream going until the canal looks clean or you've used up your solution.
Okay, I really want to pause here because this is a huge safety point. The tip of that syringe should never, ever block the opening of the ear canal. And why does that matter so much? Well, you need to let that solution flow back out. If you block the exit, pressure can build up inside the ear, and that can be really painful and even cause damage.
So, the main procedure is done, but hang on, we're not quite finished yet. Let's move on to our final section, number 5, aftercare and documentation. These follow-up steps are a super important part of the whole process.
So what's the immediate aftercare look like for an irrigation? First, you'll help the patient lie on their side with the treated ear facing down. This just lets any extra fluid drain out. Second, loosely place a cotton ball in the opening to catch that drainage. And third, make a plan to come back in about 10 or 15 minutes to take it out and see how things look.
And to bring it all home, take off your protective equipment and do your hand hygiene one last time. Next, and you can't forget this, document everything right away. And finally, you always want to evaluate how the patient responded to the treatment in a good amount of time.
So there you have it, the whole process from start to finish. It really makes you think, doesn't it, beyond just the steps? So here's a final thought to leave you with. How does mastering a proper technique like this one not only make sure the medicine works, but also how does it fundamentally build up both patient safety and patient trust?